Hi, this is Amy Regenstreif, cancer survivor, Thrivership, getting into Thrivership. I don't really like the word survivor, actually, to tell you the truth, because survivor means barely. So thriver is the only word I can think of, but really my goal for you is to, whatever you want to do in your life in the middle of cancer, that you get to keep doing it, or if you want to do something new, that you get to do something new. So today we're going to talk about what is near and dear to my heart, because I have struggled with this myself over the years. We're going to talk about money. Money is very important. Money is the most ignored subject in cancer thrivership ever, because you can go, like I've said in other videos, you can go for yoga, you can go get acupuncture, you can go smoke this, take this, do that, you know, whatever, but nobody really talks to you about money. So today we're going to talk about money in a couple of ways. Number one, did you know that you can negotiate some of your medical bills? Maybe not all of them, but some of them. And the best bills you can negotiate are sometimes the ones even in advance. When you go through your medical insurance, sometimes you will find that you must go out of network for services. And I won't get into the whole thing today about health insurance because that's a whole nother story. But very often you will have to pay cash for certain services, especially with rare cancers, especially when you need second opinions, especially maybe when you're getting weird drugs, and the list goes on and on and on about money. So you can negotiate your medical bills. If you're talking to a doctor out of network, you might want to talk to his office manager in advance about your insurance and how that works. But let's talk about getting later bills and things that happen from time to time. I have worked privately for people in negotiating medical bills. I do not do that anymore. Don't ever ask me to do that privately for a lot of reasons, but there are many things I have learned along the way. First of all, I'll give you an example. This is a real client of mine where this happened to. Actually a young person, which was pretty crazy. So this person was in the hospital and needed rehabilitation. This hospital was owned by a certain corporation. So because of this hospital owning this, this corporation owning this hospital, this corporation also owned this rehab unit, and they also owned the skilled care nursing facility. So when this person went to the hospital, they were funneled through rehab, and that was okay because your health insurance will cover you for your acute care, they'll cover you for your rehab. But then something happened along the way when it becomes long-term care. So instead of going back to their insurance company and checking where they should go after rehab, they let themselves be funneled into this skilled care nursing facility where they needed to be for a while. And what happened was they were not handled insurance-wise properly in this facility, and they ended up with like a $50,000 bill. This kind of craziness happens all the time. And I was basically contacted to help negotiate this bill. And you can do that. So I guess what I'm trying to tell you is to check your insurance, number one. Number two, let's say you just get a bill from the way your insurance set up, you went to all the right places. Let's say you just get a $17,000 bill from the hospital or a rehab unit or physical therapy. You can negotiate these bills, whether it be a payment plan or having them take off some money. What you first need to do as well is you need to call your insurance company and make sure they did the right thing. Did they code your bill properly? You know, all of insurance, it's not done by people sitting there at a desk anymore like the old days. It goes through computers. There are very specific codes for your insurance. But perhaps if a code was changed, that also could save you thousands of dollars. An example of that is probably, let's say, a colonoscopy, believe it or not. A colonoscopy is coded differently, whether it's preventative or whether you actually have colon cancer. So you need to check, so that's just an example. You could save thousands of dollars on your colonoscopy if there's some kind of medical reason for it, rather than just going for preventative. So most people don't realize that. So you need to check every little thing. So let's say your illness is coded properly, you've gotten the most out of your insurance, and you're dealing with a hospital bill. Number one, if you're having money issues, do you qualify for charity? And I mean seriously. you want to apply for charity, you want to have your taxes in order, you want to have all your paperwork in order so you can apply for charity. Sometimes there's charity, sometimes there's even gift giving from, an institution will receive a gift from somewhere that somehow gets funneled down to the patient. Have you applied for everything through financial aid that you can possibly apply for? After that, you might want to contact a professional negotiator. It may pay for you to sit down with someone for an hour, which I don't do anymore, don't ask me to do that. It may pay to sit down with someone for an hour to help teach you how to negotiate a bill. You may be able to get thousands of dollars off the bill. Did you know, for people really in financial straits, that in order to save your credit, if you just paid on a bill $10 a month possibly, that you might save your credit? Most people don't know any of these things. So these are just a few tips about money today. I thank you for tuning in. If you want to contact me again, amyreg@aol.com, or request me as a friend on Facebook for further tips. And watch the next video. Thank you.